Hello, my name is Talisha Yanez. I'm an occupational therapist that specializes in pelvic health. I've been an occupational therapist for 2 years and I've been working in pelvic floor therapy for 1 year.
Awesome.
So when we talk about the pelvic floor, there are a lot of functional aspects to that area. So one being continence, so being able to control elimination of bowels and bladder. So if someone's having issues with continence or pain with either one, then they would be a candidate to come to pelvic floor therapy. Also, women who are expecting or are just postpartum that are having issues with either incontinence or pelvic pain or have experienced episiotomy or tears, they'd also be candidates for pelvic floor therapy. And then just anyone in general that's experiencing pelvic pain, they would be this would be a good alternative for them. The nice thing is that everyone has a pelvic floor, and so men, women, and children would definitely, if they needed to.
Men need pelvic floor physical therapy too?
They do, yeah. They have a bladder and they have a rectum, so obviously incontinence can be an issue for them, but also after having issues with like prostates, or even some pelvic pain, that can come up with men as well.
Interesting.
A lot of times I get recommendations from doctors. Women will go in for their 6-week checkup and they'll notice that certain things are a little different than before having the baby. And so a lot of physicians will refer at that time, but I do have some clients that come in before their 6-week check-in, just to make sure that everything's okay, or even they already had some symptoms going into labor that they want to start addressing right away. The other thing is that sometimes people wait 2-3 months to see if those symptoms do subside, because incontinence does come on after labor and it is common, but if it doesn't go away within the first 2-3 months, then that's when we want to make sure that we're addressing those needs.
Gotcha.
Yeah, so I usually have clients give themselves 6 to 8 weeks to start seeing progress. If they haven't seen progress at that time, then we kind of go back to basics and talk about adjusting a few things, but clients will usually start seeing some improvements in 3-4 weeks.
Awesome.
The first thing that I start off with is getting a thorough history on their background, including like medical, personal, pregnancy history, just so that I can understand all of the areas that might be impacting the pelvic floor. After we get all that information, I usually move into doing a physical exam, and the physical exam has 2 components. It has the external and the internal. So for the external part, I just want to make sure that the joints surrounding the pelvis are healthy, stable, and they're working within their typical ranges of motion, and that they have appropriate strength. I'm also palpating, making sure that all the tissue is healthy. And then after we do that, we typically move into the internal aspect. So either vaginally or rectally, we do an internal exam, depending on what you're coming in for. And again, we're just palpating like we do any other tissue in the body, to make sure that it's healthy. Obviously, if it's not appropriate, we don't do it, but if clients are hesitant and aren't comfortable, that's totally fine. We have more than enough to do with the external part that we don't have to do the internal, and then once clients are comfortable with that, we can move forward with that. For the most part, I try to be super gentle, just because these muscles are not very big and a lot of pressure isn't really going to help the muscle get healthy and better. Some people will report discomfort, but most of the time we try to steer clear from any pain.
So you're usually like checking in with the person like regularly?
Yeah, I try to talk through the whole process with clients when they come in. All of the evaluations have a plan of care, and in that plan of care there are goals that are developed. All the goals are focused on the functional aspect of the use of the pelvic floor, or focused on pain and its association with function. So if someone's coming in with reports of pain with certain activities, we're checking in to make sure that the pain has diminished during the engagement and participation of those set activities. If someone's having issues with continence, then that's another goal that we'll establish based on how they're doing with bladder leakage or fecal staining. That's another way for us to monitor the progress of their functional ability at that point. So we do use biofeedback during our sessions, and it's a really great way to not only monitor the progress of the patient or the client, but also a really great way to teach the patient how to work on relaxation or on strengthening at home, because they're able to feel in their body what that looks like based on what they see on the screen here. So it can be done externally and internally, just based on what the client's needs are and what they're comfortable with, but it's a really nice visual for us to check on the pelvic floor muscle tone, whether or not we need to work on increasing the tone or bringing it down, and kind of guiding us that way. I would definitely recommend that they seek out a pelvic floor therapist in their area, or going to their primary care physician and asking about pelvic floor therapy in order to get the services that they need.
Awesome. Thanks so much.
Thank you.
Bye.
Bye.